I want to start off with looking at COVID cases, COVID deaths, COVID vaccinations. I want to look at flu, because there was no flu season last year. I want to look at medical claims. And I'm speaking in an oncology meeting, and one of the things about the oncology meeting was all the delayed visits to oncologists, no mammograms, no PSA tests, and so forth. And so we're seeing the long-term ramifications of that now. And then we'll look at where we are now. We'll look at some launch excellence stuff, which is which products are doing the best, where the investments are, and we'll wrap up. So COVID cases, this is the 7-year average, or 7-day average. You can see on the left-hand side is cases, on the right-hand side is deaths. And first of all, you see that those rates are coming down. I live in Florida. A couple weeks ago, about 6-7 weeks ago, it was 150,000 new cases. Now it's 27,000. So it looks like for the moment it's behind us. As we were talking at lunch, is if you look at a college football game, a pro football game, with nobody wearing masks, and we haven't seen any outbreaks of COVID, maybe we're putting this behind us. And the deaths, same thing. And you notice that this Delta variant, which had a lot of conversation about it, was not as deadly as what we saw at the end of last year, at the beginning of this year. And I have a little bit of distrust in the stats, because with a COVID death, you don't know whether somebody died of it or died with it, because we know the hospitals make more money if you died with COVID on the record. And then just the New York Times had to publish a retraction this week, because they had claimed there was 900,000 kids that were hospitalized because of Delta variant, and the reality is there were 63,000. So they were only off by 15 times, which is just a total embarrassment in my part. No wonder why people don't trust things. This is the red is the deaths, the cases is in the blue, and the percent of the population is in the gray. And you see that immediately it's 50 and over is where the deaths are. 50 and over accounts for about 95% of the deaths. 70 or 65 and over, 79% of deaths, representing 17% of the population. The other thing the New York Times did say yesterday, which I thought was very interesting, they said if you're 70 years old and you're vaccinated, you have a better chance of coming down with COVID if you're unvaccinated 5 years. So, we have a lot about masking and all that other stuff, and this is the mortality. It's on the right-hand side. This is the doses administered. You see that April was the big time frame, and then it kind of dropped like a stone. It came back up a little bit with the Delta variant, and this was through 10-4, dropped down again. But if you look at 10-11, that's when people started going for the boosters, and so that number will jump back up. This is just retail. You can see this. These are more finite. You can see that they were starting to pick up in retail, and a lot of these, the retailers, I can't emphasize enough how much they stepped up with testing and vaccines and so forth. So the vaccination rates are pretty good. We had a conversation at lunch today. Is that what we don't count is in these numbers the people that had COVID and recovered have antibodies. So we have to be pretty close, if not there, to herd immunity. Because you got to add those two together. If more people get COVID and recover, that makes the number higher. And of course, the big issues right here is, when does the Moderna booster get approved, or are you going to need it? When does the J&J booster get approved? And then what about the 12 and under people for vaccinations? These are the people that aren't getting it, and interesting enough is that the 30 to 49-year-old is the biggest group that doesn't have it. That's followed by the 18 to 29% that don't have it. And what shocks me the most is the 50 to 64 that didn't get it, considering that they're part of the mortality rate in the United States. The social economic factor, it kind of skews to lower income, lower education, and so forth, with the caveat is that PhDs are not necessarily enamored with the vaccines. So go figure. Racial identity, kind of the same thing. And if you look at who got vaccinated most, it's the Asians, followed by whites, followed by Hispanics, and followed by blacks. And those numbers are coming up, but it does look like anybody that wanted to get vaccinated has been vaccinated so far. And so I wouldn't expect these numbers to change other than the booster. Flu. One of the benefits of having COVID was there was no cough, cold, and flu season anywhere around the world last year. It was 94% less than on average last year in the United States. And there was a lot of speculation in retail pharmacy. Are people going to come in and get their shots like they did last year? Well, the answer is it looks more like what the behavior was in 2019 than it looks like what it was in 2020. So the numbers are going up, but it's back to where we were before, not to where we were in 2020. Now, this is the red line there is cough, cold, and flu RXs, and you can see there's 3 years there, and you know, more than there was in 2019, but certainly less than there was last year when there wasn't a cough, cold, and flu season. And this is a big cough, cold, and flu is a big deal, you know, for a lot of manufacturers. We do have a report called FAN that looks at flu type illnesses and symptoms, and here you see the 3-year average, and the red line there looks like it started up a little bit higher than normal, and that's not because of the flu, it's more because of respiratory virus. Everybody said that you know, you've seen a lot of respiratory virus in the South and so forth. We can break these symptoms now down to cough, fever, sore throat, nasal, earache, and then ILI is influenza-like illnesses. And you notice that's the one that's flatlined. That has not moved at all. While the other ones tick up in earache, tick up in nasal, tick up in sore throat, tick up in cough, tick up in fever. So one of the things I did is let's look at Australia and see if Australia might be a proxy Southern Hemisphere. Their flu season is from May to November. You see the 5-year average there. You see the 2021 number is certainly better than it was in 2020. I mean, if you could better in the eyes of who you're talking about. I mean, I guess it's worse if you got it, but better if you're manufacturing. And substantially below the 5-year average. And, you know, as I said, it all depends on what side of the flu you're on. And their vaccination rates are very similar to what they had the previous year. So that gives me some hope that the flu vaccinations will be strong. So that's all things COVID considered. Let's look at market trends. And you know, I think I mentioned this virtually last year, is you got to look at medical claims, or what we call diagnosis visits, because that's how a prescription gets written, or one gets filled, or what have you, or refilled. And there was, in 2020, there was a billion fewer, almost a billion fewer diagnosis visits, meaning a visit to a healthcare practitioner, an institution, a nurse care practitioner, physician assistant, you know, clinics, and so forth. And that's 19% fewer than what was anticipated. And here you have the gap, and you see endocrinology, rheumatology, primary care practice, oncology, neurology, and gastroenterology. So there was a big gap in these visits of what was predicted to happen, or what would have happened without COVID versus what happens now. And at this conference I'm at, oncology, they had someplace, you know, they shut down a lot of the diagnostic places during COVID, and some diagnostic things are running 24/7 just to catch up with you know, radiation, and you know, catch up with it. The numbers are better this year. They're only down 11%, but we're not back to where we were before. And the hardest hit specialty and is pediatrics. Now, pediatrics, the left-hand side is 2020 medical claims, and the right-hand side of that is new prescriptions. Now, the pediatrics is different because the kids didn't get sick. They may not have been in school, or they may have been wearing masks, so they weren't bringing those, they weren't catching diseases from the other kids bringing it home. And that's why the pediatric number's down. You see ophthalmology, derm, allergy, primary care practitioners, and I'd be happy, you know, I'm sorry this kind of gets, you know, squeezed together, and be happy to give you a copy of this, is that you look at you can look at the specialties and see which ones are getting more claims and more prescriptions, which ones are getting more fewer claims and fewer new brand prescriptions, and you can see what they are. And the reason I look at diagnosis visits because there's very strong correlation between that and prescriptions. And as you'll see a little later, and think about it, is when we got to January and February, we're kind of blissfully going around, and then COVID hits in the middle of March, and places started to shut down. The doctor's offices, the institutions, you name it, was shutting down. So it was an issue for people that were going to be newly diagnosed. And you'll see a little later the level of acute prescriptions and new prescriptions dropped way below average, while refill prescriptions and maintenance prescriptions held up fine. Because if you already had a prescription for it, you could get a refill, and a lot of those refills were 90-day prescriptions. Now, looking at currently, we can look at institutional claims, office claims, telemedicine claims, elective procedure claims. And this chart looks at, we've just eliminated 2020 as an aberration. We're just looking at 19 and 21. And you see that there's been big gaps, between 2021 and 2019. Sometimes they didn't close, but basically is that elective procedures are shut down again during the reoccurrence of or the occurrence of Delta variant. So they had opened up, things were looking better, they closed down. Office visits always had done better. They recovered quicker, and they stayed open as people learned how to do that. And the institutional visits, like elective procedures, same thing as elective procedures, weakness there on medical claims, and it started getting better. Then it tailed off. And then telemedicine didn't really rise to the occasion, didn't exist really in January and February, but it's now settling into around 6 or 7% of the claims. It was high as 1 week, 20% of the claims, now at about 6, 7, 8. And the issue with telemedicine is doctors are more reluctant to prescribe new therapy over a telemedicine call than they would physically. Partly because telemedicine doesn't have the diagnostics, the vitals, and the labs as you would need in an office visit. And if they're shutting down the institutions and the offices, hard to get those. So this is the blue is telemedicine, the green is the office visits, and the orange is the institutional visits. So you see office really did recover, and then the telemedicine is dropping. You see the medical claims, down 1% over the last few weeks because of the Delta variant. I'm sure we're going to be coming out of that, it kind of reverse itself. And I made the comment about the bottom part is the office claims, the top part is the institutional claims, and to the point, and probably the thing is that look at the cumulative, which is the dotted line, and you see we're back up to more normal in offices, and you see that in the institutions, starting at week 35, we regressed on that. They had recovered, then they regressed again. And this is just looking at telemedicine seeking its new level. But a lot of you're seeing more comfortable, more comfort with telemedicine. You see these are the specialties that there was a 15% gap if you had a derm product. Is people that went to an office got 15% more prescriptions than if you did telemedicine. And if you look down here at some of these other ones, 50%. So it really, what you learn by looking at these numbers is it really depends on what specialty you're talking about. What's the product mix?
Doug, where was oncology?
Oncology is right here, and that's this one right here. And there's been a big uptake in oncology recently.
Are there differences in reimbursement rates for telemedicine across those different specialties, or are those consistently lower?
They're probably consistent. I mean, it all depends. At the end of the month, they're going to decide, because during COVID, they let telemedicine practice nationally. So you could be a doctor in California seeing somebody in Florida, and they're going to make their decision up at the end of the month whether they're going to continue with that. But I think that a lot of those fees were waived, and we'll just see is going forward where they land at. I'll skip this one over. This is elective procedures. So you see elective procedures, institutional claims kind of look the same. Now, where are we now? And the first thing with COVID is that notice that where the big drop off in dollar sales was in the non-retail side of the business, and that the mail and retail held up pretty nicely. And in fact, their growth accelerated because they were less affected by than the non-retail side. Now, when you notice that 2018 non-retail was up 11%, by 2020 it was only up 2%. Now it's accelerating. So the next thing is, let's look at how this non-retail breaks out. So you see clinics double digits to now 8%. Hospitals, they declined by 5% in 2020. Now they're back up and with acceleration. The long-term care was the one that was hit the most, which makes no surprise because that's where the disproportionate amount of mortality was in long-term care facilities. And because of that is the occupancy rate maybe dropped from 90 to 80 in long-term care facilities. And then one of the reasons why home health care has held up so nicely, if you're making the decision, is do you put somebody in a long-term care facility during COVID, or do you try to get them treated at home? Chances are you would try to get them treated at home, particularly in the state of New York. Specialty versus traditional. It's most people had predicted by now, especially would be more than 50%, and it's now 48.9, while traditional is 51.1. And part of the and you see that specialty is growing at 7.5 and traditional is growing at 6.6. Reason traditional is growing, that's where the COVID vaccines are, is on the traditional side. Now let's break out how the traditional dollars and the specialty dollars break out into retail, mail, and in non-retail. You see that in retail, it's 84% of their business is traditional, is in mail is 18.5, and in non-retail it's 33. So again, it depends on the product, and so specialty is that mail is about 82% of their business is specialty. And the other thing is, since I've been dealing with a lot of retail audiences, they want to know why the specialty business has declined on a dollar basis in retail. And really, that's because there's 2 generics came into the HIV space, one for Truvada, one for Atripla. And they went from very expensive items to very inexpensive items. And here we break out specialty by, which are the top 10 in retail, what's the top 10 in mail, what's the top 10 in non-retail. And so you see immunology is in mail, that's number 1. Oncology in non-retail is number 1, followed by immunology. HIV in retail is number 1, followed by immunology and oncology. You also notice that the hepatitis C, it wasn't too long ago, 5 years ago, we were talking about the tsunami hitting the United States, which was hepatitis C cure, and that became a big class, and now it's declining because they basically decided people that are going to need liver transplants, liver cancer, they'll try to encourage them to get the cure. But when I was in a meeting earlier this week and talking to some long-term care facility people, they say that population, the Hep C population, is a very hard one to get a hold of. And not only hard to get a hold of, but hard to get them to finish 8 weeks of therapy. I hadn't kind of thought about that before, but that really makes a lot of sense. These are the top. The bigger the ball is the better the growth. And from left to right, that's the 5-year growth. From bottom to top is the 1-year growth. And if you see that kind of below that diagonal line, that means that class is starting to lose steam. So I already talked about HIV for the reason genericization part. Multiple sclerosis, the same thing, a lot of generic in that space. Oncology is biosimilars. It's a combination of biosimilars and not having as many newly diagnosed patients entering the oncology space. Immunology is still strong, anticoagulant is still strong, anti-diabetes is still strong. And you see that, you probably read this, is that more demand for pain medicines during COVID, more demand for mental health for patients.
In respiratory, same issue.
Respiratory, I think, is more of an issue of, it was used a lot, the inhalers a lot for early COVID, and they found different treatments for that now. I think that's primarily the primary reason for that. Here again, when we're looking at the difference between new brand activity and new to brand prescriptions and total prescriptions, you see pediatrics way down, but you're starting to see some of these specialty classes really starting to grow. So it means that we're kind of putting this behind us. I do have to, we're going to be at round 52 on let's fight the pharmaceutical industry on high prices, right? And and it's always a factless based argument. And I wanted to share with you is that between 2015 and 2020, the net revenues for pharmaceutical manufacturers went up $48 billion. The number one reason they went up is because of new products. The number two reason they went up was because of protected brands volume, meaning products already on the market, there's more volume for those products. That was really dropped by loss of exclusivity, $71 billion. And then you notice this protected brand price. It starts to go back to the Trump-Clinton campaign when you had double-digit pharmaceutical price increases. They've been at 4 to 5% since that time. And in my mind, a list pharmaceutical price is the most meaningless number ever designed. And if you're on the wholesaler side, you got to love AWP, average wholesaler price, which means ain't let's pay. And last year, net pharmaceutical prices went down 2.9%. Now, there's criticism about the launch price, and what I didn't know that there's a big debate between the National Pharmaceutical Council that thinks the ICER stuff is a bunch of crap, and they're really kind of supporting tough. So we'll see how that one shakes out. And then, the big gorilla in the room is hospital services, and this is the thing that 20-year inflation. And you see hospital service lead that list, 200% inflation over that period of time. And that is surprisingly followed by college tuition. You don't see that in the paper, do you? And then college textbooks is number 3. I don't hear any politicians talking about price of college tuition. And as it was said today, is that the largest employer in almost every congressional district is the hospital. And that's where the sacred cow. And then where you see medical care services, that's where pharmaceuticals is. That's inflated 120% in that 20-year period. So I just, use this at the next cocktail party you're in when somebody's beating you up.
Doug, that previous 2 slides, do you have that by therapeutic area by any chance? I've known Doug for a very long time.
Yeah.
So.
Well, just drop me a note and I'll see what I can do.
Thanks.
So let's just look at prescriptions for a second. So we can look at this on an unadjusted basis or adjusted basis. The unadjusted started to come back. Those are the COVID vaccines. They've been declining from some time because people are moving in 90-day scripts. And you see that's why the adjusted prescriptions look better. And this goes to where I told you before, is look at this gap here, this green gap. So at the top, it's the 2020 number. You see the gap in 2020 in acute prescriptions in 2020. meaning March, April, and May, and into June. Same thing held up with new prescriptions. You really didn't see that down here with refill prescriptions and maintenance prescriptions. So the issue was getting a new prescription and an acute prescription, or a combination of those two. And the checkered line is obviously shows the vaccines, which were so crucial there. And when you look at in terms of volume, is that again going left to right, this is the 5-year CAGR, and then from top to bottom is the 1 year. You see that where the growth is nervous system disorders, anti-diabetics, mental health, and you see again respiratory agents kind of follow the same pattern as you saw on the dollar basis, which means I think this what I really thought, and then kind of in the middle you see lipid regulators and so forth. Just a couple things on retail class of trade. Is who did the best? Food stores. Who did the worst? Mass merchandisers. So think about the decisions you might have made when you're venturing out, you know, during a year ago, during March, April, May, June, is that you may have decided, well, if I got to go to the food store, I might as well get my drugs there too. And I'm probably going to avoid going to Costco or Walmart or Sam's Club, where there's just a whole bunch of people there. So the share for independent pharmacy and chain held up, food grew, and mass merchandise declined. And the other part of this equation, you can't watch TV without seeing a good RX commercial. And those cash discount cards are growing significantly, and they're taking business away from everybody else. And what I find particularly interesting is that how, if you have prescription insurance, is that why it would be less expensive for you to use a discount card than to get it off your prescription plan. But that's the case in third party. That is the case in Medicaid, and that's somewhat the case in Medicare Part D. Patients and adherence, we're talking a lot about that. There was more patients than ever before going into retail pharmacy. You see the number that the top green number was the patient count with COVID vaccines, and that is substantially higher than it's ever been. So there was more traffic going into these stores than before, and then 37% of the patients now have a 90-day script. This is what adherence looks like. And Medicare Part D has the best adherence, followed by third party. The worst adherence is cash, which is not a surprise. And the Medicaid adherence is pretty crappy. And this is when the social determinants of health come in, because a lot of times those Medicaid prescriptions are free. Maybe the issue there is that it's harder to find doctors that want to treat Medicaid patients. These numbers are getting up higher, so there's been a lot of improvement in Medicaid, and I've always been surprised about only about 10% of the prescriptions in Medicaid have 90-day supply versus much bigger in third party. And the rationale or the mindset of these states is, well, we may not have that patient 90 days from now. And some of these 90-day things are so cheap that it would not make a big difference. And we talked about vaccine reluctance, and what I've been making the case over the last few weeks about 22% of the patients, retail patients, are not going to be adherent no matter what you do. 10% are on the cusp; they're either going to go one way or the other, and you have 70% are adherent. So that's probably some of the same people that are not getting their vaccine. So that's a challenge. And we know 90 days, since we talk about your medication possession ratio. So we're probably more adherent than we ever were in May, June, July of last year, when everybody went to get their 90-day scripts and they had them in their medicine cabinet. Didn't measure whether we took them or not, but you did have that. So the numbers are higher. And then kind of the thing that initially caused me to scratch my head, but it makes a lot of sense. If you're adherent to your antidepressant, you're more likely to be adherent to the rest of your medications. And look at the non-adherent to the antidepressants, that's in like the 50% range. If you're adherent to your antidepressants, it's more adherence is like 80%. And we talked about the social determinants of health. Just a couple things on generics and biosimilars. The generic share is about 86%. That stalled a little bit because COVID vaccinations and lack of flu season. But they are a tremendous bargain because it's only 10% of what we spend. It's 90% of the spending, or 90% of the prescriptions or so, and 10% of the spending, and that number continues to drop. But the big thing, and probably the most significant thing we will see, since hepatitis C is in 2023 when Humira faces as many as 6 biosimilars. And that's one of the first biosimilars that's on the pharmacy benefit side, pharmaceutical benefit side, versus the medical benefit side. And see that we're starting to get critical mass in biosimilars. They've penetrated the 3 Genentech cancer products, supportive care, diabetes. So we're going to start benefiting from that curve, and the launch curve of these things are much higher than they were in the past. But like anything else, there's so many perverse incentives that create the atmosphere. Is that it's much better for the plan sponsor to have a $1,000 product with $500 rebate than a $300 product. That's just kind of the reality. And probably what the plan sponsors are doing is they're using those rebate dollars to subsidize the rest of the healthcare premiums and things of that sort. And this loss of exclusivity, obviously the big one is 2023 with Humira. So there's plenty of opportunities, but I don't think the generic share is going to get much higher, because you have all this innovation coming. Opioids, just a couple things. Opioids peaked in 2011. They are down on a morphine equivalent basis, half of what they were back then, and they're back to levels they were in the year 2000 and 2001. Yet, the overdose rate is really going up. COVID certainly created that. And one of my peeves with media and politicians is they don't describe what somebody overdosed on, because their perception is it's a prescription drug. Well, the reality is fentanyl. Synthetic fentanyl, followed by methamphetamine, followed by cocaine, followed by heroin, and actually the number of prescription opioid deaths has gone down. This is 2015 to 2019, and I bet you the 2020 numbers, since they're hard to get, are going to show even a bigger increase. And the sad thing is that these things are, you don't know if you're going out to get cocaine whether fentanyl's in there, or you're going out to get heroin. So it's a real dilemma for these kids that want to get high. Digital apps, we did a report on that, which I can, a little later on, you can click the link and you can go to any of our reports in the Institute reports. There's a lot of new apps coming in, and you had the pandemic certainly had a role, and a lot of these were proximity apps. So who were you in touch with during COVID? And more than 2/3 of the apps use categories that now include apps of highest quality, including managed most chronic conditions and so forth. And you can see the downloads here. The Doximity telehealth, see that one. See suicide apps, particularly later in the summer. You see blood pressure. You see the exercise apps. And there's apps for everybody. So I encourage you to get a copy of that, and then you can see by what the exercise and fitness, which were the beginning ones. I mean, so if you start out thinking about an Apple Watch, which was count your steps, and now it's kind of progresses. What's your sleep look like? What is your what's your heart rate look like, and so forth. Product launches. So just got 2 sections to 2 sections to go, 10 minutes, no problem. Okay? You with me?
Yes.
Okay. Product launches. Thing about product launches, well, let's go back. Is the FDA in 2020 approved more products in 2020 than it did in 2019, despite you had COVID. Now the number of launches went down because it was very hard to launch a new product, particularly you need a lot of intensive labor, meaning infusion, titration, all of that. The 55 launches through August, pretty good. 36% of those are oncology, 15% is central nervous system, and what's coming up is infectious disease. That's where the COVID thing is. The #1 launch, which actually just launched in June, was a weight loss drug from Novo Nordisk, which is kind of a version of a lot of their diabetes drugs because they cause you to lose weight. And that was a meningococcal vaccine and glioblastoma. So this is a summary for 2021. I guess the thing would be the launch by therapy areas. You see that the oncology ones are going up. The central nervous ones are going down, and infectious disease is going up. And of course, the big thing, if we thought Hep C was big, first effective Alzheimer treatments would just be monumental, considering how many people have that. So the launches have been okay. These are the top 10 for this year so far. I mentioned the top 3, but you get to you get past 1, 2, and 3, and you see a lot of cancer drugs, 1 HIV, one overactive bladder, and this is 2020. And to the point you asked, is that the #1 product in 2020 was a COVID-19 monoclonal antibody from Gilead. And one thing to watch for is does the J&J product, which is a pill form, get approved before the end of the year. I know the government's bought a whole bunch of it already. And the sad thing for pharma is that this is what the launch trajectory looks like. It's way below what it used to be. If you couldn't see a doctor face to face, you couldn't get an institution. How do you launch your product unless you're Ubrelvy or Nurtec that you can lend yourself to the digital channel, or unless you had an ultra rare eye disease drugs like Tepezza, and then you have we talked about Veklury for monoclonal antibody, and then you have some biosimilars there. So last section, outlook. So I've had these on the list for a long period of time, and it really doesn't change much. What the issues are. Probably for this group is there was a price increase backlash. It's something you always got to look for, but that's kind of largely gone away to more launch price. People are becoming more specialized. There's more oral drugs, declining pain dollars, declining Hep C dollars, orphan drugs, and then you have these copay accumulators, which when you get to $125, the abandonment rate increases dramatically, and you have all these blocks on specialty drugs and so forth, which makes it very complicated. These are the 10 issues that we think that should be on everybody's radar screen. One is unemployment, healthcare, economic impact of COVID-19 in the face of recovery. And we see that every day in some way, shape, or form. And you walk down Main Street and you see restaurants are closed because they can't get people. And you had a record number of people quitting last month in the hospitality industry. Vaccine rollout, distribution, reimbursement, administration. Healthcare reform under the Biden administration. What are they going to do? What do they keep? Expanding payer control in pharmacy and medical reimbursed products. The medical reimbursed products is kind of the third rail. Hard to do something, but that's where the expense is, and we got to figure out a way to do that. Growing net price pressure in immunology and other specialty markets. We talked about these accumulator adjuster programs that impact government price calculations. 340B program was designed for indigent patients, so much so that Duke, which has 5% of their population, made $250 million at 340B not too long in the past. Permanent shifts in patient-sided care. I'm always interested in the health hubs and CVSs, the minute clinics. Walgreens has doubled their investment in Village MD, so I think that's going to be, you see more of that in the future. And pharmacies see patients 10 times more often than other healthcare providers, which works in that area. Value-based pricing agreements. The agreement, at least the consensus at the oncology meeting was where you'll see them will be in these gene therapies. That'll be the first place that you'll see those small patient populations with a lot of evidence, and then obviously the impact of disproportionate access and affordability for minority and underserved patients populations, which we talked about today. I'll skip this over because this is redundant, and this is the 5-year trend. Sorry that the categories got cut off, so I would encourage you, to get a copy of this. And that's immunology, oncology, and neurology that lead the list on that. So with that, I thank you very much for your kind attention. This is the link here to the IQVIA reports. So you see on digital health trends, use of medicine in the United States, global health trends, prescription opioid trends, global oncology, global medicines. There's about 20 or 30 of them in there to take a look at. And then if you need to reach me, that's my email address, doug.long@IQVIA.com. So I'm sorry that I couldn't stick around a little longer. This is always one of my favorite things to do.
Do you have time for one or two?
I have time for one or two questions. And just to show you that not only did I get the 4:15 panel discussion today, I have a 7 a.m. panel discussion on oncology pipeline tomorrow. And the guy's supposed to like me? I mean, it's going to cost him. But anyway,
that's a problem with Doug being popular, right? Does anyone have a question?
I have a question. Do you have experience of vaccine hesitancy with some of the earlier vaccines that have been developed? Because I've been involved in developing 3 and never recall anything like this resistance.
No, I haven't looked at the numbers, but I would agree with you. Is that and you blame everybody on where we are today. Starting with if there's a vaccine that was developed under Trump, they wouldn't take it. And in fact, it's remarkable that we had 250 days. I mean, that's utterly remarkable. And I'm just shocked. I mean, and it's hard to reason with people that that it's your age group that for some reason or not they decided not to get vaccinated.
I just one question. It's not on the data or anything, but you've talked in the past about the reputational problem that the pharmaceutical industry went through. Do you think that there's been any? Do you think the pandemic and the development of these vaccines, so forth, in those days, has that helped the reputation? And do you think it's heading in the right direction?
Help, but you always I think it's heading in the right direction, and they, pharmaceuticals have done more to save healthcare costs than anything else. That they don't, it's not appreciated. Part of the issue is that you immediately see what the cost of the pharmaceutical is when you get it. Versus if you go to a hospital, you may not see what that treatment is for another couple of months. So reputation has gone up, but if you look at some of this vaccine hesitancy, you look at some of the comments and so forth. Some people still think pharmaceuticals is an evil empire, and the reason that they want to mandate these vaccines is to make the pharmaceutical industry more profitable. It's just go figure.
Well, they're certainly looking at them. I mean, just your chart showing the hospitals' costs going up versus pharmaceuticals, they're definitely looking at the wrong end of the telescope.
Yeah, where they're looking at, it's easier to beat up on a pharmaceutical company than it is the local hospital. That's right. And why they ever let them merge? Because we were just talking at this meeting, and is that one of the payers, Magellan, he said, you know, they're treating somebody in a local clinic, and the local clinic gets bought by a larger hospital, and all of a sudden the price goes up 5 times.
For doctor services, right?
Yeah. Well, there's another chart that Adam Fine put out, because I guess the specialists were complaining about the high cost of pharmaceuticals. And so he did a chart that had 7 countries. The first one for MRIs and CAT scans, and we're the most expensive places for MRIs and CAT scans around the world. And he did also one on salaries. So their specialty salaries are just follow the same thing with CAT scans and MRI.